finally, let's welcome Dr. Maria Rivell of Novant Health Family and Internal Medicine, South Brunswick. Welcome, Dr. Rivell.
Thank you.
I'm so happy to see you today. It's really nice to have you on the show. And I suspect there may be a few people out there who haven't met you yet. So let's introduce you by way of sharing some of your background information about your education, where you've been. I'd like to know where you grew up.
Okay. I grew up in the Philippines, and I did my medical school over there. And after that, after graduation, I came here to the United States. I did my internal medicine residency training in New York City in Mount Sinai.
Oh.
And then after that, I moved to North Carolina.
Oh, nice. Mount Sinai's been on the TV recently with the
it's a hot
coronavirus
spot,
and stuff.
right.
That's a very popular spot.
Right,
so.
right.
I'm curious, did you always want to be an internal medicine physician, or did that come to you later?
Not really. It all started with my mother. She's the beginning of all this. She always wanted to be a doctor.
Really?
But then she was in that generation where if you're a woman, you cannot be a doctor. So she became a teacher instead. But she made a promise to herself that when it's her turn to have children, they will become doctors and have the opportunity, even if they're girls. So here we are.
That's an amazing story. I love that. I love that. And so internal medicine was always your choice, not family practice or not?
Yeah, because I'm really more keen into things. As an internist, I only see adult patients, and there is a lot of multiple medical conditions, complex, and my approach is to treat the patient as a whole, from a wide range, from wellness to complex medical conditions.
That's interesting. So you ended up in North Carolina. So how did that happen? What brought you to Brunswick County?
Okay, well after residency, we moved to an area near Charlotte, and I was there for 23 years.
Oh, wow.
I started working for the local hospital, and then we had an opportunity to do private practice for about 12 years. And then when everything was becoming bigger, like healthcare systems, we rejoined the hospital there. And then we've visited and vacationed here in Sunset Beach.
Oh.
And we've always talked about, my husband and I always talked about maybe retiring here. But last fall, when my daughter started college, that's the youngest one, I thought, well, why do we have to wait for retirement?
Exactly.
So I started looking around, and here we are.
That sounds like my story. Our kids went away, they went to college, and went to college in North Carolina, and stayed.
Right.
So I looked at my husband one day and said, you know what?
Right.
Let's go.
Right, yeah.
So here we are. It's a great place to live. And when did you join Novant Health?
So actually I started in the fall, in November of last year. So this is about my 8th month.
Yeah. Well, we're certainly happy to have you. And I understand you're at the clinic, the South Brunswick Clinic.
Yes.
And let's talk a little bit about that clinic.
Okay. So the name of our clinic is Novant Health Internal and Family Practice of South Brunswick. We are located at 75 Emerson Bay Drive in Carolina Shores. It's a small town right there.
It's always hard. Some people say, I live in Carolina Shores, but they really live in Calabash. And
Right.
then those who live in Calabash will say, I live in Carolina Shores. So
Right.
It's kind of confusing.
Right. Now, those are two little different towns now.
I know.
And I remember that when they had their inauguration,
Right.
they had to invite the mayors of both towns.
Right.
Not hurt anybody, just playing safe, because it's for
That's right.
both communities
Yeah.
anyway. So our practice is a combined family practice and internal medicine. So we see a wide range of patient population ranging from infancy to adulthood.
And do you have a particular interest, a special interest in women's health, or?
Not in particular, because I only see adult patients, and for some reason, they have more complex and more chronic medical conditions.
Right.
So it's really the whole thing, the whole package. It's very challenging and
I bet.
and sometimes frustrating.
It seems like the older we get, the more medicines we're on.
That's right.
The more, and we have a little bit of this, a little bit of that.
Right, exactly. It's just
I
part
don't know
of
how you do
getting older. But we see a lot of very healthy adults in our practice.
So I know this has been a very unique time for us at Novant Health and for all of our practices. It was a tough time to join us. You joined us, and then all of a sudden a pandemic happened.
Right.
So some of the patients out there I've heard have delayed care or delayed services because of that.
Right.
And what would you recommend to patients who are due for a wellness check or it's their annual physical? Should they come? Should they not come?
Right. For a lot of relatively younger and healthy patients who have delayed or postponed those annual physicals, I think, I'd say that this is the time now to start calling and scheduling those annuals again. Those who have postponed or delayed their screening, preventive testing like mammograms, pap smears, screening colonoscopies, bone densities, lab work, and immunizations. This is a good time now to start scheduling because we are getting busier again, so we want to be able to get them in. Because for those patients, you want to be able to maintain that general well-being, okay? And then, especially for the patients who might be a little bit older, those who have chronic and or complex medical conditions like diabetes, hypertension, heart disease, lung problems, those who have kind of delayed or postponed checking their lab work, if they're running out of medications, those A1Cs, the time is now. You should start returning to those clinics and not delay, because for them, you don't want to start having complications.
Correct.
Right, okay?
Yeah. That's very good information. Talk about the safety measures that you have in place in your office so that patients will feel more comfortable coming.
Right. In our clinic, and for most of Novant Health's clinics, we have a lot of safety measures in place. They seem to change from week to week depending on how the pandemic is progressing or improving. But right now, we have a staff member who is right outside the office.
I've witnessed that.
They start
myself.
early in the morning before everyone starts coming in.
Right.
They are wearing masks. And then every patient who's scheduled or who's supposed to go into the clinic are screened. There are a series of questions.
Right.
They check their temperatures.
Right.
They offer them, if they're not already wearing a mask, they offer them a mask before they go inside. And then once inside, we practice social distancing.
Right.
And then for the common areas like the waiting room and then the patient rooms, we went from cleaning it every day to cleaning it after every patient encounter, because we want it to be safe for both the patients and for the staff as well.
And you're doing virtual visits, is that correct?
Yes. Virtual visits in the form of video visits or e-visits. It became very popular during the last 2-3 months, but we are...
I think everybody wants them now.
Yes, but now, most everybody is beginning to feel safer about having this face-to-face visits again with their doctors. But for those who still feel a little bit concerned or worried about it, or they have high-risk medical conditions, we are continuing to offer that as an option.
Right.
Right.
And are you taking new patients?
Yes.
Great. Well, I know there are folks out there who are viewing this and would love to make an appointment. So tell us how we can do that.
Several ways. If they're coming as a new patient to the office, they can call the telephone number, area code 910-579-8363. For those who have that My Chart, it's a patient portal online.
Right.
They can actually go in there and start scheduling an appointment, and that will show up in our schedules. All providers in our clinic are accepting new patients.
Wonderful, wonderful. And again, the name of the clinic?
It's called Novant Health Family and Internal Medicine of South Brunswick.
South Brunswick, great. Well, it was such a pleasure to have you on today, Maria.
Thank you for having me.
We were finally able to get back on the air.
Right,
We've had
right.
to take a little hiatus.
Right.
But we're back now.
Yep.
And thank you for being one of our first guests.
Thank you again for having me. It's a pleasure.
Thank you.